Welcome back to Studio Chatter. Fighting addiction is a life-altering challenge, and there are times you need full-time help. And with some new ideas on how to combat addiction, welcome Nancy Spitzer from ARDU Recovery Center to the Chatter.
Thank you.
Welcome.
Hi, Nancy.
Hi. So tell us about your role at ARDU. What do you do?
So I'm the clinical director, so I'm over the entire clinical department.
Okay.
So we have a multitude of therapists there. So all of our clients get an individual session. We do intensive family therapy. And then on top of that, we create their treatment plan from the day they come in and their aftercare plan. So, and then we work together. We work with the medical team, the nursing team, and make sure that we're all communicating. We also offer case management services. A lot of our clients have legal issues or they have FMLA, so we need to communicate with their jobs to make sure that when they're there, their sole focus is on recovery.
Oh, wow. And when you talk about recovery, recovering from what exactly?
Sure. So that's a really good question. So our clients, in order to be a patient at our services, they need to have a diagnosis of substance abuse. Mm-hmm. And then we also take clients with mental health issues. So depression, anxiety, bipolar, schizoaffective. So we work with a variety of different individuals struggling with mental health as well.
All right. And you're in Provo.
We are in Provo, yeah. So they renovated a nursing center and they've done a fantastic job. It's a beautiful facility and I'm really grateful to work there. It's a wonderful place for people to get better.
And I've been there and we chatted there and it's beautiful. You guys were featured in Utah Valley Magazine earlier this year and have done a write-up and you guys just got off the ground a couple of months ago. So you're new. Are you starting to fill up? Do you have space?
We are starting to fill up. So our specialty is really detox science. So basically we are able to detoxify clients suffering from alcoholism, drug abuse. And that's really what our specialty is. We have a full-time medical staff as well. So if your loved one enters our treatment, they're never without someone monitoring and watching them. So it helps our clients really develop an understanding of what's going on because there's staff always with them. But then also for someone who's maybe their spouse is in treatment, they don't have to worry about them. They're in a safe place.
Okay. And how many people would you say you are able to?
We have a capacity for 76 beds.
Oh, really?
My goodness.
That's huge.
Yeah.
Oh, wow.
So
what's the average stay, or is that too general of a question?
No, that's a good question. So for detoxification services, it's average 10 to 13 days depending on what the substance is.
Okay.
Alcohol detox is typically a little bit longer. Same with benzodiazepine, that can be longer. Opioid use, it can be shorter. And then our residential program is 30 days.
On top of the 14-ish days.
Yeah.
Can you describe to us like what detox looks like?
From my perspective, so when we have a fantastic physician assistant, Blake Rapier, who is just amazing, and we have a great director of nursing, Amy McAllister. So our clients really get hands-on service. Blake is there full-time. So our clients are actually very motivated from day one. They're on medications, but they're monitored, but they still can participate in groups and individual and family therapy, and most of them really do want to.
Right.
So from that perspective, obviously there's still the sweats and feeling, kind of awful in the beginning days, but it's a reminder of where you're coming from and where you need to be. And if it wasn't a struggle in the beginning, you might not ever go through that process, and that's an important process. So that's kind of what it's like in the beginning days. You kind of feel like you have the flu, and Blake talks about that a lot. He's really educational with our clients, talks about, the addiction pathways and how to rebuild pleasure pathways in a healthy way without using drugs and alcohol. Yeah.
So are most of your clients there at their own will? Some against their will, maybe?
Some are, I would say they have court issues, so they come in for, to work on that. But most of them really have a desire to change their lives. They've been dealing with this for 10 plus years and are just done. They're tired, they're exhausted. They're in a really a difficult place of pain. So it's time for them to start a new life.
Okay.
What's been your success rate as far as people coming in and leaving?
So far we've had 100% success complete our program. We have an alumni program, so every Thursday evening we offer a meeting and a meal to our clients. So a lot of them love to come back. They really love our staff. Most of our staff is in recovery, so they come from a very similar perspective, and they really want to, catch up and see the other clients and give back and connect.
I like that idea to come back, because then you're part of a community, and I think that's just huge, and you're held accountable. Like, I have to go back and report. I want to have good news.
Yeah, so that's a big part of it. We all join. The staff comes for dinner on Thursday evenings too. We also provide a free family support group. That support group is for anybody in Utah or even beyond that. It doesn't have to just be for our clients. Really? So I run that. And it's for any family member, loved one, spouse, anyone who doesn't, even siblings can come to that group as long as they're over the age of 18. And we talk about a lot of real issues, like what's actually going on, how you're affected by addiction, because it's not just the person in treatment, it's also the other people around them that really struggle. So we want to get them to the place of educating them, understanding how to start their own recovery process and grow.
Okay, and what day of the week is that?
That's also on a Thursday evening. Okay. It's the last Thursday of every month. We provide that from 7 to 8 p.m.
Fantastic. Yeah. Well, I know that when I was perusing the website a little bit, we were talking about some of the holistic approaches with the float therapy and the vibrotherapy. Can you tell us a little bit more about some of those?
Yeah. So our owners really had the intention of having innovative sciences. They have either had family members or they've gone through it themselves, and they were tired of kind of the same pattern of treatment being kind of cookie cutter. So they said, what can we offer that's different for our population? And one of the things that they wanted to do was have a float tank, because it's sensory deprivation. It helps our clients. A lot of our clients who've gone through it already, it just clears their mind. It's dark in there. There's some starlights. We pump music through there. It's actually pretty amazing. And the clients for about 30 minutes get to have, they lose those racing thoughts. So it's a really great coping skill. Our biosound bed also, it provides music, so you get vibration with meditation. So that's really different. We offer, we offer oxygen therapy as well.
Yes,
so we have a whole bunch of different scents. The clients ask for that all the time, and it's just to help them. Also, some of our clients are out of state, so they're not used to the altitude here. So it's just another coping skill. Yeah. So anything we can do. We also offer amino acid IV therapy, which is a vitamin supplement that they can get, and it actually rebuilds their cellular development. So, and it's a 10-day process. Most of our clients do it during detox. It is a separate charge other than just insurance or our cash pay rate, but our clients really benefit from it. Also helps with cravings, some of the detox symptoms. So we try to provide as much as we possibly can in a short period of time so that they can really thrive.
Wow, that's fantastic.
Yeah, that sounds inspiring.
Alternative therapy, of course.
So if any of our viewers are just watching, but they have a family member or a close friend that is dealing with some sort of addiction, do you just recommend that they call and set up an appointment and see if you're the next step, or where they start, or where do they turn to?
So we even if we're not the right fit, like you were talking about, we would just love to talk to them and see what is the right fit. Not all of our clients are going to want to come to treatment or need that high level of care, right? But they can come to us, talk to us. We're more than welcome to do a free assessment on any client that needs help.
Okay.
Wow. Awesome. So where are you? Are we in Provo?
Yeah.
Okay. And what number telephone number?
Sure. So 801-810-1234. So it's pretty easy to get. So, and also just on top of that, our therapy program is very much based around the underlying issues of addiction. So we do trauma work there a lot. Most of our clients have some significant trauma in their life, and that's pretty much why they're using. So we teach them the skills, seeking safety skills, grounding skills, to give them an idea of when they leave, how to sustain their sobriety as well.
That's, I think, key.
Yeah.
They're in there, and it's a safe place, and you have that support, and you're being fed and get these different things. Like, like doing a float pot or the aromatherapy.
Meditation.
Yeah, and you're like, oh, I can totally stay clean. And then you go out into the big bad world and those temptations and
we make sure
behaviors
all of our clients have an aftercare plan as well. So we work with a lot of different facilities in the area and out of state as well to get them to outpatient care so they continue to do therapy.
Okay.
Very good.
Great.
All right.
Thank you
Thanks
so
for stopping
much.
by, and we'll
Thank
make
you.
sure to share your information.
Best of luck.
There's more studio chatter coming up.